Hello, I'm Dr. Blackburn again with Atlanta Prosthodontics, and I just wanted to bring a patient in, Miss Bobby Patterson, and she came to us with existing dentures, and she saw our ads, she saw our websites describing the mini implant procedures, and she was very interested in that. Ms. Patterson had been a long time denture wearer, and she just never got good stability with her existing dentures. She was having a tough time eating, and she came to us for the mini dental implant procedure to basically lock down her existing dentures. How you doing, Miss Patterson? You doing okay? And can you kind of tell the people how the procedure went for you, and was it everything you expected? Was it troublesome? Kind of let the people know your experience a little bit.
It's a life-saving event for me. I have not been able to eat properly for the last 2.5 to 3 years. I wasn't able to eat with my dentures in. I would have to remove my dentures. And then I ran into food allergy problems, so that really created another problem for me, because I had to more or less like eat certain foods, soups, rice, potatoes. But the rice I was unable to eat because of the food allergies, so my meals consisted of green beans, mashed potatoes, things of that nature. And meat, I would just have to ground it up. So when I found out about Dr. Blackburn and his father, I immediately came. And the first procedure that he did, which was a week ago, this past Tuesday, is heavenly. I'm able to eat with the bottom dentures in now. And some foods I'm able to eat with the top dentures, even though the implants have only been inserted at the bottom. So I recommend anybody. And see, I had a lots of bone loss. That was the main reason that the adhesive was not able to hold my dentures in. So when I found out about Dr. Blackburn's and the mini implants, and he worked very diligently with me, and him and his secretary, I recommend them to anybody that you having any problem to please come see Dr. Blackburn.
Now, how was the procedure? Because we're only basically a week out. What we did was we placed 2 lower implants this time last week, and today we're going to do the upper, which will demonstrate the procedure for you. But in this week, has it been tough transitioning? Has it been did you have a lot of pain post-operatively?
No, not really that much pain because of the medication that you gave me, and I didn't do as you told me to start rinsing my mouth with the warm salted water immediately. I waited about 2 days. So I say about the 5th day in, that's when the pain really subsided. And I was able to go 89 hours without taking any pain medicine. So the procedure was quick, fast, and even the numbing, getting to it, very, very mild. Dr. Blackburn talked me right through it along with his assistant. So I felt very comfortable.
Good, good. And now what we'll do is show you what she has, and we'll show you the upper surgical procedure, and we'll show you how we convert existing dentures into mini implant over again. Hello, Dr. Blackburn again from Atlanta Prosthodontics, here with Ms. Bobby Patterson. We wanted to show you just the mini implant procedure. Usually with the mini implant procedure, we want to place a minimum of 4 mini implants on the lower, possibly 4 on the upper. But every case is different, due to some financial constraints and everything. This case we did 2 on the bottom. We're doing 2 up top, but it depends on bone quality and other factors in which we put in the mini implants. But we just wanted to show you what Ms. Patterson received. This is her existing denture. We did not make this denture at Atlanta Prosthodontics. She came in with this, but now it is very stable. You can't even take it out unless you have some force. All right, this is her upper denture. We're going to add 2 implants in today. This is what we placed in last week, the 2 O-ring attachments. We also have implants that have what's called locator attachments that have little caps, but you can see from the little white areas that she's healing, better. This is only a week out from her little surgical procedure. Okay, she doesn't have a lot of bone, but that's what these little mini implants do. Up top here, we are going to place 2 of them up here, and then maybe sometime next year we can put 2 more or 4 more. But let's show you, this is what the inside of her denture looks like with the 2 little donut attachments. These are just like the snaps on your blue jeans, and this gives you a lot more retention and stability. Well, we're going to place 2 mini implants in the areas where I just marked. Okay. Stop it. It is 10:20, and we'll just monitor the time, how long it takes for put in a couple of implants. Okay. You made a slight incision, open real wide for me. Patient is totally numb. Any pain, Miss Patterson? She said no if you couldn't hear. Stop and see. All right, this is the size. Get real close. This is the implant that we are going to use. It's going to go inside the patient's bone, and this is a mini implant, about half the size of a standard size implant. Half the size and half the cost. Okay, stop. Okay, now we got it going. Can you see this thing? And we are screwing it in. We got good stability. And we will force it in. We're just about done here. Any pain, Miss Patterson? Okay, so the implant is good, very stable. The patient is not feeling any discomfort. It's not even as traumatic as an extraction. Okay, even though you see, just a little blood, patient isn't feeling it at all going in. Okay, so we've got the first one in. Okay, good, copy. Open wide. Nice and bilateral, just like the other one. Straight as we can make it. Lots of water, copious irrigation. Started it. Put the patient's face on. You gotta do more than just flow. Spray. Not spray. Open and full of spray. There you go. And we torque down the remainder. Almost there. Okay, so we are done. We have two solidly placed mini implants in place. Okay, and looking at my watch, that took exactly 7 minutes just to put in two. And like I said, we normally put in 4. Okay, and we may very possibly come back in another month or so and put in some more. Okay. Now, what we'll do in the lab is, since we got good stability with these implants, and stability means, that the bone is dense and that we have good implant placement, they're not rocking or they're not turning at all, then we can add the little donuts inside the denture and pick them up, and we are right about 10 days out for Christmas, and we're going to have Miss Patterson eating well for the holidays. Got the implants in place, and we are just placing the housings that are going to go on the inside of the denture. And those are the housings. Good. Stop. I have adjusted the inside of the patient's denture just to make sure that we have enough clearance for these housings. Okay, come on around here. We're going to try it in with the housings in place to make sure that it's fully seated, and it is. It's nice and stable. Okay. Then what we'll do is add some very hard, rigid reline material. It's soft when it goes in, but it gets rock hard, and it'll pick up these attachments on the inside of the denture. That'll be your female connection. Okay. Now we have picked up these heads. They're inside of the denture, nice and solid. We'll try them back in the patient's mouth. Once we get them oriented, we simply push them up. So now the patient has implants down bottom and up top. Bite down, tap, 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 tap. Okay, open. Now they're out. So a lot more stability than when she first came in. So I'm going to clean these up, polish these up, and we'll deliver everything to the patient. Okay, we're about an hour and 20 minutes into the whole procedure. Most of the overdenture procedure is my responsibility in the lab. So it's not necessarily in the patient's mouth, but it's the lab work that I have to do. I'm cleaning up the denture and the attachments, making everything comfortable for the patient. But we're now ready to put everything in the patient's mouth. This is the final product after we've cleaned it, and again, this is not an appliance that we did here at Atlanta Prosthodontics. Okay, now that's secure, and this is the upper. I would like for her to come back and let me fabricate her a new upper and lower denture. Okay. And so they are both in and secure. Good. Bite down, Miss Patterson. Tap, tap, tap. How does that feel? Does that feel more secure than it was earlier this morning?
1000% more.
Okay.
I'm not gonna cry. I'm not.
Oh, goodness. No. But it was a long time coming, because she came to us, having worn dentures for many years, and today is the first day, that things are secure. So this will be a Merry Christmas for her, because in many of our cultures, we center our holiday activity around food and eating and family, and she'll be able to do that with comfort. Yeah. All right.
And I thank you.
No problem at all. We thank you. Signing off.